posted April 1, 2018, 8 hours 0 minutes and 49 seconds. The game-changing HIV prevention drug PrEP is now subsidized by the Pharmaceutical Benefits Scheme (PBS), but NT health advocates say a complex state of play means their battle isn't over yet. The NT was the only jurisdiction not to have the drug made available through a state-sponsored trial in which it was made cheaply or freely available to high-risk groups. Previously, people wanting to access PrEP in the territory had the option of purchasing the drug, marketed as Truvada, over the counter for up to $1,000 a month. They could also turn to the internet, where cheaper generic versions could be legally imported with a doctor's prescription. The PBS subsidy means it will now be available over the counter for about $40. Daniel Alderman, who provides support and referrals through the Anti-AIDS and Hepatitis Council (NTAHC), said the drug's PBS listing, announced in February, showed modern medicine had come a long way since his positive diagnoses in the 1980s. Back then, when the infamous Grim Reaper ad was gracing television screens, contracting the virus often led to AIDS and subsequently death. It was a very frightening time, he said. Sydney used to have a gay newspaper called the Sydney Star Observer, and in '87 and '88, it was just full of death notices. HIV diagnoses in the NT by year 2017 to 92,016, 362,015, 192,014, 142,013, 212,012, 36. Source: Centre for Disease Control, NTAHC. PrEP, pre-exposure prophylaxis, is a pill that, if taken daily, is up to 99% effective in preventing HIV transmission, according to some health researchers. If you look at the trials around the country in different states, predominantly New South Wales, Queensland and Victoria, it's had an impact where it's decreased the rates of new infections by 30%, Mr. Alderman said. So any tool that we have in the toolbox to help us prevent more transmission of HIV must be a good thing, but he said the typically unpredictable risk groups in the territory left a question mark over just how effective the drug could be in preventing new presentations. Transmissions are historically low but highly variable, and have nearly doubled and then quartered in recent years. Diverse local population muddies the water. Several healthcare providers in the territory said there had been low demand for PrEP, possibly because accessing it was complicated and local expertise was low. While we were the only jurisdiction that didn't have a trial, since 2015 the local clinic has provided scripts to over 60 individuals, Mr. Alderman said. If they're still in the territory or not, we're unsure because it's a time frame and we have a high turnover of people. While HIV transmission has broadened away from the predominantly homosexual risk groups affected in the 1980s and 1990s, the territory's situation remains unique. Predominantly the people that are coming up with new diagnoses of people traveling to what we call high-prevalence countries. So they have large numbers of people with HIV, Mr. Alderman said. So the majority of my clients come from non-English speaking backgrounds. The diverse local population is part of the reason why rates of diagnosis vary drastically from year to year, and a number of Mr. Alderman's clients aren't aware they are positive until they are tested when applying for Australian citizenship. In 2012, for example, the Centre for Disease Control (CDC) recorded 36 new cases, among which 14 were irregular maritime arrivals notified by an immigration detention centre. This makes them especially difficult to target with traditional safe-sex messaging, and the diverse population moving in and out of Darwin has prompted NTAHC to work with community organizations to translate campaigns into Bahasa Indonesia, Swahili, Creole and more. So the old sort of posters of, you know, young people out partying and safe-sex messaging needs to change, Mr. Alderman said. Lucky that remote areas have dodged HIV, another risk group, according to the AMANT, are remote indigenous communities across the territory and further afield where the CDC has been combating a syphilis outbreak since 2015. President Rob Parker said we were lucky that HIV, which is more infectious if a person also carries syphilis, had not entered the communities, given the problem in containing the current syphilis epidemic across all states and territories. I think it's a real concern, he said. Syphilis can be a close traveler to HIV, so the fact that there have been significant problems controlling the syphilis epidemic means potentially there's a real problem controlling the HIV. There is precedent for a breakout in these regions after a small breakout in populations near Cairns in 2016. While Mr. Alderman and Mr. Parker believed the usefulness of PrEP in these communities was questionable, Mr. Alderman said subsidizing HIV prevention was much cheaper than subsidizing treatment. So over a life of having the virus, it costs the public purse a lot of money, over $1 million. He said, anything that can stop a person living with HIV is a good thing, because we know even though it's a manageable disease today, it's still classified as a chronic illness. Topics: AIDS and HIV, health, disease control, human interest, Darwin 0800.